Have you ever heard the phrase that in an emergency, every second counts? Well, when it comes to stroke care, there is a critical period that doctors and emergency responders call the golden hour. The golden hour for stroke care refers to the crucial first 60 minutes, or sometimes the first few hours, following the onset of stroke symptoms. This limited window is when medical intervention is most effective at minimizing brain damage and improving recovery chances. Acting quickly during this time is absolutely vital for someone experiencing a stroke. This emphasis on speed comes from a fundamental understanding of how strokes affect the brain. An ischemic stroke, which accounts for about 87% of all strokes, happens when a blood clot blocks blood flow to a part of the brain. Without oxygen and nutrients, brain cells begin to die very quickly, at a rate of nearly 2 million cells per minute. This rapid cell death is why we often say, time is brain. The sooner blood flow can be restored, the more brain tissue can be saved, leading to a better outcome. So, what can you do? The most important action is to recognize the signs of a stroke immediately and call emergency services, such as 911 in the United States, without delay. Think FAST, which stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. Do not try to drive yourself or the person to the hospital, as emergency medical services can begin critical care and communication with the hospital while in transit. Within this golden hour, specialized treatments like tissue plasminogen activator, or TPA, can be administered. TPA is a powerful clot-busting medication that works best when given within 3 to 4.5 hours of symptom onset. For some patients, doctors may also consider a procedure called endovascular thrombectomy, which uses a catheter to physically remove the clot, often effective up to 24 hours in select cases, but with better outcomes if performed much earlier. These advanced interventions are highly time-sensitive. Understanding the golden hour empowers you to act decisively if you or someone you know shows stroke symptoms. Rapid recognition and immediate emergency response are the most powerful tools we have to preserve precious brain function and significantly improve the path to recovery after a stroke.